How EMS instructors can effectively teach mental health topics.
My name is Jameel Sylvia. I am the EMS Product Manager for Public Safety Group. And I started in EMS at the ripe age of 18. I started just out of high school. I completed my EMT program in my senior year of high school. I eventually went to advanced EMT school and then later became a paramedic. I worked for a couple different EMS organizations during my time, but my true passion has been in EMS education. I started teaching probably about 10 years ago now in community college and in some private training institutions. I did my master's thesis on titled The Need for Enhanced Training in Mental Health Emergencies for First Responders. And I did that back in 2019 with the goal of identifying some of the gaps that exist in mental health education and try to enhance the training that our first responders get in working with that particular population when they respond to calls. And fast forward a couple of years, when I started working for UCLA, I had a unique opportunity to be the PI on a research project. And that research project was to develop a curriculum for initial education programs to enhance their behavioral health content. So over the last going on 3 years now, I've worked with our team of psychiatrists, psychologists, and EMS experts in the field to create this content for a paramedic education program. And I was honored to be able to present some of that research at last year's EMS World Expo.
How are EMS instructors teaching mental health today?
In some of my anecdotal research that I did for prior to creating this curriculum, is I reached out to program directors and EMS instructors across the country, and I said, how are you teaching your mental health content? And most said it's either an asynchronous lecture, meaning students just kind of read it and take a quiz on their own, or it's a 1 to 2 hour in-person conversation going through the PowerPoints, and then we're done, right? It's not the most, quote, exciting material to learn as a student, right? I'm sure most students are wanting to be engaged in trauma care and some of these complex medical cases, right? When you talk about behavioral emergencies, right, it's not the exciting stuff to them, right? So I think there's a lot of struggles when it comes to how do I teach this effectively to engage the audience, to engage these students, and actually have them walk away learning something. Right? Because it's particularly hard to have conversations with students who have had behavioral health emergencies training when they're an EMT, when they're an advanced EMT, and then now they're getting almost the same content in paramedic education. So how do you make that different? How do you make it more engaging and exciting and powerful where they're walking away learning something that they didn't know before?
What are some challenges in teaching mental health to EMS students today?
One of them is the cultural stigma that still exists in EMS, right? Despite the progress that I think we've made, and I think we've come a long way in the last 5 to 10 years, EMS culture and fire culture still values this toughness, the ruggedness in that emotional control, and that the students often arrive with a lot of various stereotypes, right, about those who experience mental health emergencies or crises. There's a lot of discomfort discussing emotions and psychological distress. There's a fear that acknowledging that stress equals weakness. I also think that there's a lack of instructor training and confidence, right? There's, yes, a lot of the educators that teach in these introductory programs come from the streets, right? They have that experience. They've worked as an EMT, they've worked as a paramedic for years and years. They know how to do the job effectively, but do they know how to teach effectively? There's limited resources specifically for EMS education. And I think we're getting better, where we're trying to build more and enhance the instructor perspective and try to build better instructors so we develop better thinking, critically thinking clinicians. But there's still a lot of training and confidence building that needs to happen. There's also a lack of exposure to different crisis intervention models, right? Because things vary from state to state, county to county. How we take care of these patients can differ, and sometimes how an instructor is trying to teach how they take care of behavioral health patients in their community is not necessarily aligned with what's considered best practice and what might be in our textbooks and what we should be teaching our students. And I think another barrier or challenge is time, right? We're trying to jam so much information into the brains of these students in 160 hours, maybe for EMT, or 1,200 hours for paramedic. And a lot of that time, the instruction and curriculum is based and developed for the bigger ticket items: trauma care, shock care, complex medical calls, OB and special populations, right? The mental health emergencies is a very small nugget of that. And often it's just not given the time that it deserves.
What topics would you include in a mental health lesson plan?
The curriculum that I was able to develop for UCLA incorporates an 8-hour didactic component. So students are in the classroom for 8 hours and we're talking about mental health, right? It doesn't mean that I'm standing in front of the classroom and pontificating for 8 hours. It's 8 hours of engagement. It's 8 hours of some deep conversations, but it's also some education and training on de-escalation. So de-escalation is a big part of the conversation that we have, is how do we build rapport with patients? How do we verbally communicate effectively? How do we avoid inappropriate nonverbal communication? Because we can recognize that about 80% of our communication with folks is nonverbal. So how do we make those interactions feel more welcoming and less intrusive? How do we engage in a patient's personal space? How do we have conversations with them? One of the things that is often missed is that these types of responses don't have a protocol, right? There's no set way of how to go through an algorithmic based assessment, which is very different than how we teach other facets of pre-hospital care. When we are going through, when we're teaching about medical emergencies or trauma or injuries, right, there's a structured assessment and approach that we follow to ensure that we're not missing life threats and that we're performing comprehensive assessments to rule out other things, to hopefully get to the real reason we're there and treating the right thing. Then we kind of use our protocol to help us figure out how to treat it. But these types of calls don't have that, right? This is what we call the gray area of EMS, right? Every mental health call, if that's the call that you're going to, is going to be a little bit different. But then also we need to have conversations about the actual mental health disorders, right? What is stress, anxiety, bipolar, borderline personality, suicide, and how to identify acute risk versus someone who has chronic suicidal ideations, and what types of tools can we use to identify those who are at the highest risk, who need to be seen now, versus those who have chronic suicide, who this is their kind of day-to-day kind of state. And then how do we engage with those members? How do we engage with those patients and give them the best support? What resources can we offer them, right? There's a slew of resources that a lot of EMS providers don't even think about that we could be sharing, especially if we're not going to transport that patient, that we could be sharing with them so they can walk away with something, right? Maybe they don't have a therapist. Maybe they don't have the ability to get their prescription medications. Maybe they don't have the ability to contact their utility companies, right? 988 is a thing, right? If those who are suffering from, suicidality and suicidal ideations.
How does the newest edition of Emergency Care and Transportation of the Sick and Injured help teach mental health?
And I think the resources that are available for EMR and EMT, the crisis prevention resources, the mental health resources, those are links that students can then access to learn more. Right, to get more information and also to be able to help their patients out. There may be something they identify there that they may want to share with patients. Maybe they had never heard of 988 before, right? And maybe the patient has never heard of it either. Maybe that's something they share in their conversation when they're out in the field with a patient who is having suicidal ideations. I also think that the simulator could be really interesting because, again, if there isn't the capacity to build good quality simulations in the classroom in a skills lab setting, right? That the mental health resource that's on the platform that works with the simulation could help at least engage students in working through different communication techniques, de-escalation techniques, on how to work through that style of call if they weren't able to actually do it in the classroom setting.
How should instructors teach mental health to younger generations?
Don't take it for granted that everybody does know it. Just because the younger generations may have more exposure to it, whether we don't know what their upbringing actually was or is. And I think it's important that we level the playing field and make sure that this content is delivered in an effective way to all students, because there is something that they can walk away with, regardless if they've been, in the mental health field or they've been brought up with this content all their life. There's something to be learned by a student in any session they go into, and there's something that we can teach them that's new that they may be able to walk away with and tuck it away as a tool in their toolbox that they can use on a call that they go on in the future. This content is important. I think it's not taught enough. It's not taught effectively from the lens of EMS. So regardless of who's in the classroom and what their experience is with mental health, they would not have had the lens from an EMS perspective. So I think it's absolutely important that everybody gets this level of training and enhanced training to be able to take care of our patients more effectively.
For EMS instructors and program directors, explore behavioral and mental health resources in Emergency Care and Transportation of the Sick and Injured, 13th edition.